Hi.
Hi, I'm a level 1 nursing student and I was assigned to you today.
Oh, good.
Do you mind if I ask you a couple questions?
No, go ahead.
Okay, thanks. Why specifically is this client receiving this medication?
He has heart failure, and we're trying to maintain a safe heartbeat on his with this medication. So we're gonna give this beta blocker to help him out with that.
Okay, what action does the medication have on the body?
What action? It changes the conduction of electricity of the heart, and therefore slows down the heart rate. It helps with the contraction of the heart, and it also it causes vasodilation, which also helps with his blood pressure.
Okay, when should you question administering this medication?
Of course, if the patient has allergies to it, you would question it and not give it and consult the healthcare provider. But mainly if he has a blood pressure that is too low, so we don't want to lower that, and we also don't want to give him if his heart rate is below 60, because you don't want to slow that heart rate even more and then cause more damage than it will do good for him.
Does the medication have a therapeutic serum level?
Not that I know of. If it does, we'll find out. We'll give a call to the pharmacist and we'll find out.
Okay, what vital signs must be monitored?
Just the heart rate and blood pressure mainly. You might want to look at the EKG and make sure that he doesn't have like an AV block, which is another something that this medication can do as well. But mostly heart rate and blood pressure.
Okay, which physiological parameters should be monitored when the medication is being administered?
That sounds like me. The main ones is going to be orthostatic hypotension. So we want to make sure that when the patient gets up for the first time, we will be there with him. We'll put the bed alarm on, and if he forgets to call us, at least we'll catch before he falls. And cardiac output, and just make sure the safety for the patient, really.
Okay, I have a couple more questions.
Oh wait, those questions come later, right?
No, I'm not done yet.
Oh, okay. The 3 questions at the end?
Yeah, I'm not done.
Okay.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In the hospital setting, it will be mostly, we will be the ones taking care of it because we're going to administer the right dose, the right time for the right patient and all of that. So for him at the hospital, there's not a lot besides getting up with us. Just make sure the bed alarm is on and let him know that he shouldn't be getting up by himself. And that will be pretty much it.
Okay. What interventions must be taught for taking the medication safely at home?
Make sure that he knows how to measure his heart rate and blood pressure correctly and when to withhold the medication too as appropriate. Let him know about changing position quickly. We shouldn't be doing that. Getting up, should be getting up slowly, sitting up on the side of the bed and things like that. So, same.
Okay. What are the side effects and potential adverse reactions?
Side effects would be lowering the heart rate, lowering the blood pressure too much. We want that, but we're not too much. It could cause AV block. It could cause pulmonary edema. It could cause weakness, fatigue. So those are the main things.
All right. How will you know the medication is effective?
If it lowered the blood pressure, this is what we're looking at, and make sure that his heart is at a safe rhythm and that it's doing better for him than it is doing worse.
Okay, that's all the questions I have right now.
All right, let's go in and administer the medication then. First thing, you got the medication. Okay, so I'll come in. supervising. Hi, Mr. Mice, how are you doing? He's doing okay. I came in here, my name is Hanan, I'm the nurse on the floor, and we have Kevin here, a student on level 1. We're going to be administering your medication today, which is a beta blocker. You're supposed to be getting that this morning. Is that okay with you? And he was going to say yes. So I'm going to check the bracelet, make sure that that's his name, got the bracelet right, make sure that his date of birth matches. And what is your first and last name and date of birth? And he's going to say, and it matches the bracelet. And I see that you don't have any allergies. And do you have any allergies that you can remember right now? And if he doesn't, we'll continue. So, wait, I would have washed my hands before. So I would come in again. I would come in, wash my hands, and then touch the bracelet, find out if it's right or wrong. So now that I have completed it, we'll go to the computer, make sure that it's the right patient, the right medication, the right dose. So here we go again. And so I have Palmyra, medication, beta blocker. He said his name is date of birth. We're good at that. All right, so we're good. So I'm gonna get his medication. I'm gonna scan his bracelet, scan the medication, make sure that all the doses are right. I already did that once there, did it again here, and so I'm gonna get him a cup. Are you okay swallowing this pill? Is there something that would be concerned, or are you good? He seems to be good. He talks and he hasn't had problems swallowing. So I'll open a pill for the little cup. Give him a cup of water so he can sip with, and he's sitting up. He swallows it, and the medication's didn't check the blood pressure. But I did check it earlier on the computer. I just didn't check it right now.
Yeah.
So check the blood pressure before I give the medication, and make sure that it's safe. It was safe 30 minutes ago when they last took it, but I should have checked it again, make sure it didn't go lower. So before I would open the pill and give it to him, make sure the blood pressure is correct. And so administer it, and we would be good to go. And so would ask him if he needs anything, make sure the call light is within reach. The bed is at low position, and he's good to go, and let him know that we'll be here in about half an hour to check his blood pressure again, make sure it's maintaining a good level and it's not causing too much of a drop and not doing any effect. You do have to call us before you go to the bathroom, just for the first time, so we see you getting up. This medication may cause you to the blood pressure to fall when you're getting up, so we want to make sure that you're getting up when you go into the bathroom and you're going safely, and with just one of us, one of the staff here. And do you have any questions for me? And if he doesn't, then we'll move on. And all right, I'll be back here in half an hour to check the blood pressure again. So we walk back to our nursing station.
Outside the room,
and so how was it? Did you like it?
that was so cool. I hope one day I can pass drugs like that.
You will. 3 semesters ahead of you.
I have some more questions for you.
Oh, really? Okay,
Yes. All right. If there were pertinent pieces of information you reviewed before administering the client before administering the medication, what were they?
We did review the blood pressure and heart rate, and it was good. It's all within limits, good to administer. If it was lower than what we want, we would withhold the medication. Blood pressure too low, heart rate too low. We don't want any of that. That's mainly it.
Okay.
And he was good, so that's why we administered the medication.
Did this information affect your decision to administer the medication?
No, it was good. His heart rate was good, and his blood pressure was good. It was good when we took it earlier, and we took it again before administering the medication, and it was good.
Did this information affect how you administered the medication?
No, he took it orally, and he he's able to swallow it and no complaints, and he talks while he swallowed it just fine.
Okay, that's all the questions I have.
All right, peace out.